everyone, I'm Kirsten Davidson, your host and creator of my wellness podcast, Mind the Gaps, where we work on surrendering our typical ways of looking at life to step out of our comfort zone and into our growth zone. Welcome to episode number 26, Beyond a Couch and a Cardigan. In today's episode, I'll be unpacking the ins and outs of psychotherapy, explaining how it does in fact go deeper than the old guy sitting on the couch with a pipe asking, and how does that make you feel? And absolutely no shame to the founding fathers of therapy and psychology. Their work is incredibly important for the foundation upon which we've been able to build on this today in the modern world. And for that, I'm grateful. And what I'm even more grateful for is how therapy is starting to become more normalized. I look at it as something that should be as regular and routine and destigmatized as going to the doctor's office or going to the dentist. And we can see the needle slowly moving that direction, especially over the past 20 years. But we've got some work to do, and so I'm honored to be able to clarify, clear up, and provide insights to any of your questions on what really is therapy. To get the ball rolling on that question, I put out a poll on my social media the other week asking viewers what they would like to learn more about when it comes to therapy. I also asked friends and family and took note of frequently asked questions I've received as a therapist. So I've compiled them all here, right in front of me, and I'm ready to answer them on today's episode. Be sure to listen close to hear if yours was included. For all things Mind the Gaps, you can find me on Instagram at kirsten.davidson, in addition to my new website, mindthegaps.co. If you like what you hear today, taking a moment to rate and review the podcast episode is always greatly appreciated. We couldn't do this without your support, so thank you so much for tuning in, and I hope you enjoy. Okay, question number 1. Isn't a therapist just someone who listens to people vent? I already have friends and family to talk to. What difference would it make if I went to see a therapist? This one is probably the most frequently asked question we receive as therapists, and it's a fair one because going back to the intro, a lot of the time therapists in movies and pop culture are portrayed as people who sit there and ask, so how does that make you feel? I'm always reminded of Jamie Lee Curtis and Lindsay Lohan in Freaky Friday. For those of you who haven't seen this iconic movie, Lindsay Lohan switches places with her mom, and her mom is a psychologist. So her mom tells her to sit there and ask her patients, so how does that make you feel, anytime she's not sure of what to say or do in the session. Now, although that's fun and cute, the sessions do go deeper than that, and so it does take more skill and a little bit more patience to be able to ask the harder questions and explore with clients really how they can move through the pain rather than just speaking it into existence. So I refer to myself as an integrative psychotherapist, which means that I draw upon a variety of therapeutic modalities to meet my clients' individual needs where they're at. I look at my mind as having this kind of library of all the different modalities that I've studied and practiced in and read about, and whatever the client needs in that moment, I kind of pull from that library based on whatever would suit them best. And so some of the main ones that I draw upon are trauma-informed therapy, which is kind of an umbrella term that encompasses a bunch of different approaches. So we also have narrative therapy, attachment-based therapy, cognitive behavior therapy, acceptance and commitment therapy, mindfulness practice, existential therapy, emotionally focused therapy, and last but definitely not least, parts work therapy. So parts work therapy comes from a approach called internal family systems theory developed by Richard Schwartz. And this one I've referred to in episodes prior to this, and I'll probably do another episode on it later. But I find it so fascinating because essentially it surmises that we have an internal family. This family is made up of all the different parts that make us who we are. We use this language all the time. A part of me wanted to do this, and a part of me wanted to do that. And through this work, we're able to go back in time, even if it's just yesterday, and access the part of us that intended to do XYZ, or the part of us that protected us from a trauma when we were younger, a part of us that's holding us back from being the fullest expression of ourselves. And this work is so rewarding. Oftentimes, When clients are able to access these parts of themselves and speak to them and understand them, there is an emotional release and they're able to better relate to themselves and to practice some more self-compassion and ultimately shatter these beliefs that have been holding them back. And I've experienced this also as a client, so it's pretty amazing to see my clients experience that as well. And this is where we come to an important distinction between venting and working through emotions from a psychotherapeutic standpoint. So venting is informal and unstructured. It's usually a spontaneous emotional release. This is still very important and can be very beneficial. This is where family and friends can step in to be the shoulder to cry on, to even give some advice and to help you go through that emotional release. There's no professional guidance in this context unless you are venting to someone who happens to be in this field and who puts their therapist hat on for you outside of the office. This is where the listener can offer comfort and validation, but doesn't necessarily have the skills to process or resolve the deeper issues. So this is what I like to call accessing surface level emotion, where it's important to identify the feeling, but taking that feeling, putting it in your back pocket and saying, I'm going to take this to a professional, that's where the journey can change for you. So in therapy, there's a structured format. When I say structured, what I mean is we're using evidence-based techniques and modalities to help clients understand and work through their emotions and their challenges. We are providing validation. We are that shoulder to cry on. However, there's a little bit more of a goal-oriented approach here, and we're also looking at it objectively. Objectively, we don't have any stake in the client's desires for change. This doesn't mean that we don't care about our clients. Of course we do. But helping a family member move through struggle is far, far, far more unbiased than helping a client do so. So really having that objective, outside third-party bird's eye view on the client's life gives them the ability to see things from another perspective. When we're asking people close to us to look at the stuff in our lives, they can't really zoom out as much and they can't detach as much as a therapist can, because I don't know this person before I meet them in their first session. I don't have the history that their mom or dad or brother or sister or partner does with them. And so a lot of the time, as much as I get this question, I also get a lot of people coming to counseling saying, we just needed someone to look at this from an objective third-party position. When I say we, I'm referring to couples and families. I also have individuals who will say the same thing to me, saying that they just wanted someone on the outside to give them that insight. Here's also where therapy differs from venting to family and friends. As a therapist, especially my approach as a therapist, I'm going to be challenging my clients. And when I say challenging them, I don't mean fighting them. I do mean pushing them outside of their comfort zone and moving into their growth zone, saying, okay, I hear what you're saying. Let's look at it from a different perspective. Rather than with family and friends, they might be nervous to challenge the person on this. They might be scared to say, I hear you, but have you tried looking at it from this perspective? Because if they're emotionally invested, they might not feel comfortable to do that. So with a client, say they come to me saying that their partner is doing XYZ and they're so sick of it and they're feeling that they have not been heard in their relationship, I'm also going to listen for cues of how they're showing up with their partner. And if I hear that they might be doing or saying things that could be hurtful to their person, I'm of course going to validate the hurt that they're receiving, but I'm also going to challenge them to look at how they're showing up. And here's how this might be different for if the person vented to a family or friend. Person venting to their family or friend, they might automatically side with the venter, saying, oh, that guy's a piece of shit, you should leave him, he's not worth your time, you deserve better, and not really giving the time of day to explore how they are both contributing to the conflict in the relationship. Why does that happen? Well, it's well-intentioned. These people are trying to protect the person that's venting. Now, as a therapist, I am also trying to protect this person, but I don't have that emotional investment. So I get to say, okay, let's look at this objectively and figure out what you guys are both bringing to the table. And sometimes all that person needs is a nudge towards the perspective outside of themselves and outside of the people in their life to be able to start making changes. And with that example, I'd also like to just quickly touch on the flip side of that coin. A lot of the time, people are told that they're making a big deal out of things, especially in relationships. So someone might, on the outside, look like they have it all together, but on the inside of the relationship, they're not feeling very satisfied. And so if they're complaining about the relationship, the people in their lives might be telling them that they're the problem, relationships have issues, you need to suck it up, this is normal, this is a you problem, you need to figure it out, rather than hearing the person and looking at, maybe the partner is actually not fulfilling this person and maybe they're not showing up in the ways that they would like for them to show up. So as much as part of the work is challenging clients to look inwards and recognize their own shortcomings, it's also to validate that sometimes people around them are mistreating them. And in doing so, that can be really empowering and help them step out of the mindset of the people around them that are saying they should stay and more into their intuition and their truth, their authentic self that's saying that maybe it would be better to leave. Wow, okay, so that was a very long answer to question number 1, but I feel like I needed to give it the space it deserves because it's one of the most common ones. And I'd like to just wrap that one up by saying, as your therapist, I am not here to, as I say to clients directly, I'm not here to blow smoke up your ass. I'm genuinely here to tell you whether or not you might be underestimating the significance of the issues in your life or overestimating them. So I will help work through whatever the feeling is, whether it's having a low tolerance for distress, blaming other people and not really seeing where you're going wrong. And I will also be there to point out when maybe you're taking too much of the blame and there are some other people in your life that need to do a little bit better at taking accountability. And as your therapist, I have no agenda beyond trying to help you empower yourself and liberate yourself from any stuck points, any beliefs that are holding you back in any regard, whether it be in relationships, in families, in your job, in your passion projects, in your hobbies, in your general physical health. My goal is to prompt perspective shifts in a way that's gentle, validating, non-judgmental, and not forceful, because at the end of the day, I can't control what happens outside of the therapy room, whereas venting to family and friends, they're probably going to keep on checking in with you. You have your session with me booked for maybe a week or 2 weeks, and in the meantime, I can just hope that the tools we've discussed and the emotions we're working to unlock become exercised, become more familiarized, and unlike responses you might get from your family or friends, I will never be upset with you if you're not applying those things. Because if I took it personally every time a client didn't step into growth or didn't apply those things, then I wouldn't be able to do my job effectively because I would have no patience. And I'm sure we've all experienced this with people in our own personal lives. Our patience can be shorter with them. Our fuse can be shorter because we want to see them liberate themselves as soon as possible. We love and care for them, and we want them to move into growth now. The struggle is, and the reality is, that this can take time, and that's where I come in. So being patient, sitting with the client, working through the emotions, getting curious about them, all in a place where the listener, me, has no agenda. Moving on to question number 2. What's the difference between a psychotherapist, a psychologist, and a psychiatrist? This one is a great one, also super common. So psychotherapists are known for providing talk therapy. This means combining various therapeutic interventions designed to assist individuals in recognizing and changing challenging emotions, thoughts, and feelings. This is a fancy way of saying that psychotherapists work with the client to empower them to help themselves, addressing the underlying root causes of the emotions, looking at the emotions as symptoms of something greater going on underneath the surface that needs to be listened to, spoken to, attended to, and understanding them in context of the greater picture. So a lot of the time people will come to me saying, I feel sad for no reason. I feel anxious for no reason. There must be something wrong with me. And I'll tell you, there's always a reason. And that's part of my job, is helping clients access that reason and have an understanding so they can validate why they might be feeling the way they're feeling. So again, looking at symptoms as a signal, as a teacher to explore explore a deeper underlying issue. So the underlying issue here might be a stuck point, which means a belief that is holding someone in place in a comfort zone rather than a growth zone. And some of the most common ones are, I'm not deserving of love, I am not inherently beautiful, I am not smart enough, I don't deserve forgiveness. And these beliefs then stimulate whatever the emotion is that comes after. So if I'm thinking about that, I might feel sad. If I'm thinking about another one of those beliefs, I might feel anxious. I might feel mad. And so that's where getting curious about the emotion can really help us access the underlying message that we tell ourselves every day. And that's where the real work gets done, applying different types of therapeutic modalities to break down those stuck points and have a more compassionate way of relating to ourselves. So psychologists can also use all of these same modalities, except clinical psychology tends to look at symptoms as pathology. So what I mean when I say that is pathology means something is wrong with the person. Like we are pathologizing their anxiety, their anger, their sadness, rather than looking at it as a normal reaction to abnormal symptoms. The reason I'm going down this rabbit hole is because in psychology and clinical psychology, these individuals have the ability to provide mental health diagnoses to clients. So they can use different assessment and diagnostic tools in tandem with the treatments. And it brings a different lens and a different messaging to the process. So breaking down diagnostics is a whole episode in and of itself, and that's why I made one last year. So if you're interested in learning more about that, then definitely refer to episode number 9, Diagnosis of Mind the Gaps podcast. And finally, addressing psychiatry. So psychiatrists primarily address mental health through a medical lens, including prescribing medication. So psychiatrists, they require an entirely different level of training and are focused more on prescription and looking at things through a medical model rather than doing the talk therapy intervention. So oftentimes I'll have people referred to me from a psychiatrist who's put them on medication of some sort and said, well, they also need some talk therapy, and so they'll come see me as well. So I like to look at these 3 designations on a spectrum from holistic to medical, with psychotherapy being on the holistic end, psychiatry being on the medical end, and then psychology falling somewhere in the middle there. Now, of course, each practitioner in each realm is going to bring their own unique flair and approach to these things. So the statements I'm making are more generalized. And I also want to be clear that when we look at that spectrum of medical and holistic, I would love to see one day a connection across all 3. So everyone kind of working in tandem rather than working in their own different camps. I think the more collaboration we can have between these different specialists, the better we'll see outcomes be for our clients. And hopefully when that happens, we can extract the good from all of these practices and be able to look at emotions as teachers rather than pathologizing them. Oh, this next one is a powerful one. I don't want to go back to the dark places from my past. Won't I feel worse by revisiting these places in therapy? I'll start by responding to this one with a quote by Robert Frost. The best way out is always through. The best way out is always through. So if we have unprocessed emotions and we have trauma stored in our minds and our bodies from years ago, or maybe even from yesterday, that we haven't taken time to sit with and look at again because it feels too scary. We're worried we'll feel all those same feelings again. You're absolutely justified in feeling scared. It takes courage to say, I'm going to sit down and I'm going to face all of these scary things I experienced so that I can move through them. Because quite literally, there's no other way to move through them without facing them. They won't just dissipate by themselves. They actually can get worse. So the metaphor I use most often, and I'll share with you now, is imagine that you have a cut on your arm. Not deep enough for stitches, but more than a paper cut. And you say, okay, well, I don't really feel like dealing with that today. I'm just going to leave it. I'm going to put my sleeve over it and I'm going to go about my day. Okay, fine. Now, let's say that cut starts to get infected because we haven't tended to it and it's an open wound. And say months go by, say years go by, you might have to chop off your arm at that point. And so this is where time alone does not heal all wounds. Time can actually make the wound fester and turn into something bigger than it would have been had we looked at it and said, I'm going to go to the store, I'm going to clean this properly, I'm going to work through, okay, how can I tend to it every day? And in the tending, it's going to hurt, right? Like when you pour rubbing alcohol on that open wound, it's going to sting. And so that's the pain of the growth, that's the pain of the healing. If we leave it alone, okay, we're gambling, right? Is it going to get infected? Is it going to get worse? And this is the same with the adversity we face in our lives and the trauma. Now, there's lots of growth that can come from pain. And in order to experience that, we do really need to take a hard look at the pain and to learn from it and to say, I don't like how that felt. And I want to do everything I can to make sure that I don't inflict that wound onto others and to protect myself from being wounded again. Another quote I'll reference here is from physician Gabor Mate. I've referenced him in probably every podcast episode to date, so apologies if you're sick of hearing his name. He says that trauma that is not transformed will be transmitted. Trauma that is not transformed will be transmitted. So how can we transform our trauma if we're not actually looking at it or even acknowledging that it's there? And that's where taking a good hard look at what we've been through is the first and only step to moving through it. Now, I do want to clarify that there is something called re-traumatization. Re-traumatization can happen when we revisit past memories, maybe memories we haven't visited in years, or maybe ones we didn't even know we had, and all of the significant negative emotion comes flooding back in, and it can feel like a lot. So those experiences we need to be cautious of as therapists, which is why delving into trauma with clients is very important to do in a safe space and with permission from the client to go there, and also without judgment. So knowing that the client is in a safe space for them to explore the emotion is huge. That's number one. And number two, the reason people will experience this type of re-traumatization is because it's been buried for so long. So we're uncovering that wound that might have festered for a long time. It's gonna hurt the longer we let it sit. Now, if and when this occurs in session, what we do as therapists is help the client slow down in processing the emotion, reintegrate into their body, be able to ground themselves, recognize triggers, reassure that they are in a safe space, that there is a trusted person with them. And once this person feels like their nervous system is regulated, that's when the work gets done. So the initial fear and the anxiety and the anger and sadness and all of the challenging emotions that come with uncovering the wound, once there's a calming down from that experience, that's where we're able to help them develop new narratives, use trauma-informed techniques in therapy, reframe the experience, and really identify the fear and the stuck points around what had happened and how that influences how they show up today. And I don't want to sugarcoat this experience because it can be scary. But what I do want to say and emphasize is that emotions are temporary. There is no situation in which you are going to uncover something and never be able to move through it. So long as you bring an open mind and an open heart to therapy, you will not be stuck with this emotion. If anything, those emotions were already stuck, just buried deep inside of you. All we've done is reveal them. The next question on our list is, how do I know if my problems are serious enough to go to therapy? Great question. Everyone has a reason to go to therapy. Unless you feel like you are the most healed, fully evolved version of yourself, which unfortunately doesn't exist for anyone, then you qualify for coming to therapy. Now, the medical model of therapy views its attendees as patients, as people who are mentally ill, that have something wrong with them, that need to be fixed. And this is where today we're kind of battling that stigma that if you go to therapy, it doesn't mean you're crazy. If you go to therapy, it doesn't mean there's something wrong with you. It's not weakness to ask for help. It's actually very, very courageous and takes a tremendous amount of strength to say, I would like some assistance on this in my life. And going back to whatever your reason is for coming to therapy, Trauma and issues in your life are subjective. There is no all omnipotent being that's going to tell you you should or should not be upset about something. If you are upset about something and you feel like you need to work through that upset, then coming to therapy is a great first step. In my opinion, there's no mental disturbance too big or too small to go unignored. And if any professional tells you otherwise, then I would suggest finding a different therapist. And this flows very well into our next question, which is, how do I know if a therapist is the right fit for me? So finding a therapist is the same as choosing a dating partner, choosing a job, choosing a friend. You want to see who is most aligned to your goals, to your mindset, to your energy. And if you're not feeling a connection during those sessions, then you definitely want to honor those feelings. So there's no need to feel guilty about this if there doesn't feel like there's a match. Oftentimes when a client comes to see me, I ask them about their previous therapy experiences. And one of the main reasons they feel like therapy wasn't working for them is because the fit wasn't right. And so when I hear that, I'm of course going to ask, what was it about that fit that felt wrong? So I can then assess if I'm able to provide what that client is looking for. A strong therapeutic relationship is crucial for effective therapy, so I invite all feedback from clients to help strengthen our alliance. It's also totally acceptable to seek out a different therapist who might better suit your needs or communication style. It's my job, too, to honor my boundaries of competence. So what I mean when I say boundaries of competence is my ability to practice certain modalities, my ability to show up a certain way for a client. If I feel like a client is looking for things that I'm not able to provide, then I'll be happy to refer them to a different specialist that can better help them with their therapeutic goals. And this is part of the reason why I offer 15-minute phone consultations. And these are free of charge to newcomers to therapy who want to explore whether or not I might be a good fit for them as a therapist. So some things that I would suggest to clients who are seeking out a new therapist is check in with how your body feels in their presence. Do you feel relaxed? Do you feel calm? Do you feel safe? Also check in on how the therapist is responding to the things you're saying. So do you feel validated by that person? Do you feel supported by that person? Do you feel heard by them? Are they giving you space to really express your truth and then allowing you time to process new perspectives? And when I said before to check in on whether or not you feel like your energies align, that's kind of a woo-woo way of saying check in and see if the person that you're speaking to is able to be with you where you're at, to meet you where you're at, rather than imposing where they're at on you. So for example, let's say your therapist is having a fabulous day. They're just feeling on top of the world, and you show up to session and you're going through grief. You've had a significant loss in your life. The therapist that's able to meet you where you're at will be able to set aside their own feelings and be with you in your pain. The therapist that is not able to empathize and get at your level might accidentally let their excitement for their own life come through the session and make you feel invalidated. So that's just one small example and one thing to look out for when it comes to relating to a therapist, making sure that you feel like they are with you on your journey, not looking down on you from above. And it's also important to talk about the reverse of that. So, say a therapist is having a bad day. We all have bad days. We're human too. And if that negativity seeps through into a session, all of a sudden is the therapist making it about them versus about the client. So always making sure that you feel like your emotions are in the hot seat, not the therapist's. And another thing to be mindful of is ask yourself, does your therapist ever challenge you? Back to what I was saying at the start. Does your therapist ever challenge you to look at things from a different perspective? Or do they only always validate where you're coming from? Like, do they ever push you to think differently? Or are they just saying, that must be so hard, you're so right, you're so right, you're so right? We can't be so right all the time. So there's got to be something in your life that they have room to challenge you on, and that's where the real growth happens. So it's very important to be willing to have someone who's going to give you that tough love. The next question we have is, how many sessions will I need to start feeling better? This question I get asked often, so no shame to the asker, but it is quite an impossible question to answer because when you come to therapy, you might have a whole breadth of goals, or you might have one goal, or you might not even be sure what your goals are. You might be there to work through a very specific, isolated problem, or you might be there to address general mental health concerns. And so therapy, I like to say, is a workout for the mind. We're not just working reactively, we're also going to work proactively and take small, consistent efforts to build that mental muscle so that you feel like you have the tools to transfer outside of those four walls of my therapy office and into your own life. And so why is this an impossible question? Well, because you might feel a breakthrough in a single session, and it might be the breakthrough you were expecting to feel after a year. Conversely, you might experience a breakthrough after a year that you didn't even know you needed to work through. So clients might experience relief after one session. They might experience relief after years of sessions. It all depends how they're showing up, what they'd like to work through, how many different goals they have, what the purpose of therapy is for them, and ultimately how open they are to change. So what I can say is when someone's starting the therapeutic journey, if it is feasible financially and time-wise, I suggest coming weekly or bi-weekly to kind of get the ball rolling and to make some movement here on the main reasons they're coming. And from there, things might move to bi-weekly for good. They might move to monthly for good. People might book as needed. I have clients on all ends of the spectrum there where people come weekly for years, they come bi-weekly for years, they drop in once a year. It's really whatever's going to suit the client's needs at the moment that they're seeking therapy. And I, of course, am going to provide a tailored professional recommendation on how often and for how long I think that they should be coming based on the concerns that they bring. Ultimately, to me, there's no end date to therapy. Healing is a process, not a final destination. So I believe that, with me developing these relationships with my clients now, I can only hope that I'm their therapist for the rest of their lives. And that doesn't mean that they're coming all the time, but it does mean they know where to find me when they need me. So we're nearing the end of our questions for today. This is our second last one. Do I need to do anything to prepare before a first session? What I usually say to clients is the only thing you need to bring is an open heart and an open mind. And that's my cute way of saying that if you come in with walls up saying, I know best, I don't need outside perspectives, I'm just here to vent about the issues in my life and that's that. Okay, fine. I can't control the openness of the client, but I will say that the degree to which you're open is akin to the degree that you will experience positive change in your life. So I always suggest this openness in your mind, in your heart, in your body to say, I'm ready to receive new things. I'm ready to change the way I'm relating to my life. And maybe I'm going to change the way that I allow other people into my life or how I allow myself to show up every day in my life. And with that openness comes vulnerability. Now, this can take time, and of course, because you're building a relationship with someone who at first is a stranger to you, it can take a few sessions to open up. Maybe you open up right away, depending on your comfortability, but also just keeping in mind that the more radically honest you can be with yourself and with your therapist, the better your outcomes are likely to be, because they can only work with what you share with them. We do some reading in between the lines, but the more honest you can be, the better able we are to meet you where you're at and to help elevate you to where you want to be. I'd like to say that therapy works when you work it. So making sure that you're showing up the same way that I related it before as being a muscle, this mental muscle that you're exercising when you're going to therapy. You don't just go to the gym a handful of times and expect to be built, or you don't just get built and then say, well, I'm done now. There needs to be that maintenance. Otherwise, all that hard work can deteriorate. So I'd say, being ready to be challenged, being comfortable with the flexibility of this process, recognizing that all mental disturbances are worth exploring, treating the process proactively versus always reactively is great, and trying again even if you've had a bad experience with therapy, bringing that open mind and the willingness to explore. The final question I'll be answering today is, how do you manage to not think about other people's problems outside of a session? Usually these types of questions are followed by, oh, I could never do what you do. I would carry that with me. I wouldn't be able to stop thinking about the client's concerns. And that's fair. I'm going to draw this back to what I said earlier in today's episode, which is as a objective third party sitting with and witnessing and walking alongside my clients through their therapeutic journey, I've worked hard to hone the skill of letting go. And what I mean by letting go is working with them in the session and letting the cards fall where they may. I can't control what happens as soon as they leave my therapy office. And so all I can do is be with them in the moment. And as the session closes off, I do this sort of energy clearing exercise. So when they leave my office, I finish writing their notes, I upload it into their file, and usually I'll sit on the couch in the office or I'll meditate, I'll do some deep breathing. And in my mind, I don't have to work too hard anymore at separating them from where I am right now, from letting them walk out the door and bring their life with them rather than it lingering in my office. Now, this did take some time when I first started doing the work and I had fewer clients and I was a student, I was an intern. It was really hard for me to let go because I would think about the cases because there were fewer cases to think about and therefore more time to think about each one. But now I see anywhere between 15 and 20 clients a week. And so I really wouldn't be able to go and live my life if I had their lives lingering in the back of my mind or at the forefront. And so these energy clearing exercises I do to create this visualization of closing off on the session. So even when I shut the door as they leave, that feels like a visual and literal closing off. The energy's outside of the room. I'm going to be with my own energy in the room so that the next time someone comes in, it doesn't feel like there's all of these overlapping feelings. Because if I carry the last client's emotions into the next client session, that's not really fair for subsequent clients. That would mean that the last client I see at the end of the day is getting all of the emotions and energy, and then my emotions and energy about their emotions and energy. And they wouldn't really be getting the best version of me as their therapist. And when I'm with a client, when I'm in their presence, whether it's virtual or in person, I very much imagine myself being in their world. So for all of my clients out there, you all have imaginary houses and spouses and friends and parents. And I kind of build this story the way that we do sometimes when we read a novel. And so as long as the client is in my presence, I feel very immersed in that story. And when they leave, when the session is done, when there's that closing off that happens, to me, it feels like finishing a chapter and shutting that book. And then the next client walks in and it feels like we're opening an entirely new book. And at the end of the day, if I've properly done this closing off after each session, when I leave, there's not really much more to think about. And when I step outside of my office, outside of the building into my car, now I'm immersed in my story. And I feel like I've opened the chapter back up of my book and I'm able to kind of reintegrate into my life. Now, don't get me wrong. At this point in the day, especially after a full day of clients, I am exhausted, but it's the type of exhaustion where I get to just go home and decompress. My boyfriend calls it me being in my decompression mode, where I don't really have much more brain power. I need an hour to kind of be with myself, to maybe have a snack, to shut my mind off, and to then feel like, okay, now I can be more of an active participant in my own life after I have that kind of recovery state. And I also want to be clear on how it's not that I don't ever think about client sessions outside of the session, and some stick with me more than others depending on how much they resonated with stuff in my own life, depending on the intensity of the emotions in that session or the progress that was made. And so it's not as if I block them from my mind completely. I want to be clear on that. But they don't overtake me, if that makes sense. They don't consume my story. I let them be their own books, and I'm honored to even be able to pick those up and to be with those clients through their story. And that brings us to the end of episode 26, Beyond a Couch and a Cardigan. Therapy isn't just about comfy chairs and deep sighs. It's about real growth, real tools, and yes, the occasional existential crisis. If today got you thinking, feeling, or ready to act on attending therapy for the first time, then I commend your courage and I encourage you to do so. If you're feeling ready to take those next steps with me, then definitely feel free to shoot me an email at kirsten@mindthegaps.co. Thank you, everyone, and take care. Thank you so much for listening. If you're enjoying the podcast, I invite you to participate in a Growth Zone challenge. I invite you to take a moment, a second, a gap in your day right now and share this episode with 2 other people. Thank you for minding the gaps with me. I'll see you next time on the journey out of our comfort zones and into our growth zones.